And when the last Lyme disease specialist said, Julia, I don't think you've got it, I broke down because I thought, yeah, but I need to know long term what I'm dealing with. You look at all the different aspects of your life, you know, your sleep, your nutrition, your exercises, and you work on those, but you don't see what correlates to what. So all the information comes from the things you track about yourself. WaveSix be on the forefront of us taking a step back and trusting ourselves again.
We just finished talking to Julia, and she's been so inspirational, talking about health and tech and how she's fused them together off the backdrop of having an incurable illness. So, you know, there's lots of takeaways there. She's spoken about from her early days, you know, traveling internationally to managing an illness, finding the strength to get through an illness, to designing an app. You know, what are your takeaways?
Well, my takeaway is I wish I had the app about 7 years ago before I got ill, because then maybe I've been able to track things and figure out what's wrong with me at that point. And also the 6 pillars, I've not really heard the holistic approach and the 6 pillars before, which you'll find out about in the episode, and really nurturing each of those pillars to get good overall health, I think was really, really interesting. So I think you're going to enjoy this one.
My name is Julia Marshall-Wessendorf, and this is my tech journey.
Hi, Julia. So you are the founder of WaveSix, and it's a holistic health and wellbeing tracking app. But what I'm really interested in is you had some fascinating turns in your career as you were moving through. Can you share with us your background from landscape architecture and set design into creating this app?
Yes, certainly. Thank you very much for having me, ladies, first of all. Nice to meet you. Yeah, I came to study landscape architecture, came to England 30 years ago. Studied at the University of Greenwich, did my degree, 3 years, spent 1 semester as part of the Erasmus program in Copenhagen, came back, did my practical year in Paris, came back to do my diploma in landscape architecture, and then even did a master in landscape urbanism at the prestigious Architectural Association in London. Went to work for an amazing landscape architectural practice in London. We worked on the Diana, Princess of Wales Memorial Fountain in Hyde Park. And at the opening, I saw the Queen. So I had a fantastic time there. Spent about 2 and a bit years with them. And then I wanted to do my practical professional exams to become the licensed landscape architect, and they wouldn't give me a day off to study, and I was getting private work at the time. So I thought, okay, I'll set up on my own. So I worked in London for a couple of years until we got married to my husband, who I met during the diploma course, another landscape architect, and then we had our first child. And in London, with a flat where you can't even get the pram in and you can't move around. And we thought, no, let's move. So we moved to Bath, and we've been here ever since. And I had our second child very quickly after, and then my third. So I had 3 children under 4, and then very soon after that, I developed health problems. So I got diagnosed with multiple sclerosis, incurable neurological condition. And that was quite a shock. So I was diagnosed with multiple sclerosis when the kids were 3, 2, and 6 months old. And it's an incurable neurological condition without a cure. So that was quite depressing. So the next few years after, I was glad I had the children because they gave me the energy I needed to get out of bed in the morning. I wasn't really incredibly bad, but enough that I just didn't have the energy to do much. So I would get the children to school, for example, but then would have to sit around all day to gather the strength to pick them up again. And that went on for, over 10 years. But the great thing was, in that time, even if I would have wanted to go back to work, it wouldn't have been possible. 3 small children and health conditions. But I found another creative outlet. So I discovered set design in that time. So I did a course at the theatre here, the Theatre Royal Bath. They had an adult learning evening course. And I figured set design is similar to landscape architecture. You design spaces for people to use, and did the course, and they picked my design to be staged at the Ustinov theatre. So that was the start of doing a few set designs over the years. And the beauty about that was that there were small projects with a start date and a definite end date. So I could very well plan around it and see how my energy went for that. And then I always thought, what do I do later? So a few years ago, then my energy finally stabilized. And I thought, do I go back into landscape architecture? Do I carry on with set design? Or do I take my learnings from those last 10 years and develop something that could help me further on?
Excellent. Oh, your story is so inspirational, against the backdrop of a health issue. We've both had various health issues, and they always come out of the blue, seemingly. And you've got to be resilient. You've got to cope. There's a lot of adapting, and that's the real human side of anyone's life, really. And I think our listeners are really going to enjoy that. I mean, when I was reading about your story, I really enjoyed hearing it, and I think I wrote you and shared some of my issues. I said, I've got Graves' disease, and that came out of the blue on my 50th birthday. I just didn't feel right, and that was the diagnosis, and it didn't go into remission. So you live with it. So you've turned your personal experiences into a tool, WaveSix. So tell us, what does WaveSix do? Tell us a bit more about it.
So WaveSix is a lifestyle health and well-being tracking app. And that lets you track more holistically. Because in my health journey, I was diagnosed with MS. And then a few years later, someone suggested it could be Lyme disease. And I then had a test for Lyme disease. It came back positive. But my neurologist said, no, it's not Lyme disease, it's MS. So I tried to figure out which of the 2 diseases it was so I could get the right treatment. And that went on for a while. I took medication for both. I went from doctor to specialist and back again. And when the last Lyme disease specialist said, Julia, I don't think you've got it, I broke down because I thought, but I need to know long term what I'm dealing with. So I thought, no, I need to change tack here. And I thought, okay, if you've got a room which is dirty, it attracts the flies. But if you clean the room, the flies disappear. So can I get myself as healthy as possible? And then hopefully my body will be able to keep whichever disease it is in check. So either the Lyme disease is caused by when the immune system is down and the spirochetes break out. And the MS is when you're stressed, you get another relapse. So I went to see a nutritional therapist and says, can you help me on my health journey? And she was brilliant because she looked at my blood tests and said, okay, Julia, see, there's some detoxification issues. Let's start really slowly. Let's just start with cutting out gluten and dairy and see how we go. And the very interesting thing was as well, she was studying to be a functional medicine practitioner at the time. Functional medicine encourages you to take more responsibility for your own health. And she took me as a guinea pig. So we had an hour consultation. And she said, how were you born? Were you breastfed? Were you bottle fed? What were your childhood illnesses? Oh, wow. And that was so eye-opening for me because I never thought about the whole picture of your health. And so that opened my eyes to looking at your whole health in a much broader picture. And what I was interested in is the holistic approach, because when I was struggling with my health, I was thinking, okay, you look at all the different aspects of your life, your sleep, your nutrition, your exercises, and you work on those, but you don't see what correlates to what. So I was looking, I had a little diary where I wrote everything down, but it couldn't give me the correlation between all the different things I was trying out. And for example, how they're linked to either my periods or the weather, for example. And I always thought I need some kind of technical know-how to help with this. So I looked at tracking apps, but all the tracking apps out there, they're really specialized in their certain niches. So you got amazing apps for exercises or relaxation or sleep or even nutrition, but nothing that correlates all this information together. So that's why I discovered or developed WaveSix, because I wanted to look at how all the 6 pillars of your health, sleep, nutrition, movement, relaxation, relationships, and self, how they correlate together. And together with feelings and the weather, how can they help you to figure out what works for you and what doesn't?
I like that. So from idea to action, that's really powerful. And the whole holistic element, because I do believe what you're saying, and you think, how do you feel? A full moon can have an effect. And if you look at the weather, the rain, certainly, my observation, comes around the full moon. So it's really powerful. So it isn't, so if there's a way out there, it's living in a natural way in tune with your environment. So your story, when I read it, I thought, I'm so excited to interview you. So, this is great.
I had burnout, stress, and I had vestibular problems. So really bad vertigo. I had to learn how to walk properly again because I was using my eyes to walk, and I didn't know I was doing it. So I was getting really bad eye strain and all this stuff. And my vestibular therapist went through all these things to looking at my diet and then exercises and lots of things. And then my neurologist was prescribing all these medications that were just making me more and more ill. And then I ended up going to acupuncture, and the acupuncture really, really helped kind of stabilise me. And then it's interesting you say these 6 pillars, because I've never heard it broken down like that, and I think that's a really useful way of breaking it down. Because sometimes you just focus on 1 or 2, and not the whole thing. And definitely when you're focused on the whole thing, like specifically nutrition, ultra processed food, I'm learning how bad that is for your body. And I really noticed, because I've cut that out pretty much almost completely cut it out of my diet. And if I do have it once, I notice how my whole body changes just from one meal that's ultra processed. So it really is, it's fascinating, isn't it?
It is. It's really fascinating. You just need to eat as cleanly as possible and really think about where your food is coming from. How has it got to your plate?
Yeah.
So I'm a total believer in that. And I just say, if you don't make time for your health, you don't make time to be ill.
Yeah.
But the thing is as well, you can have the best diet in the world, but if you don't sleep properly, if you're super stressed, if you're in a toxic relationship, it's not going to help you.
It's holistic.
Yeah. Exactly.
It's the whole, it's looking at everything, and I think it's really, really important. So were there any moments or discoveries that completely changed how you approach this app as you began to develop it?
Yeah, so for me, the main point in my whole journey was when I started working with a nutritionist, is I realized it was the psychological effect. I realized I have agency over my own health. I am responsible for it. And that's why I wanted to, with the app, to design something that would be a tool to encourage people, to empower people to take responsibility for their health. And the beautiful thing was, because nowadays with AI, with apps, just figuring out that there is a way that could be designed. Because I was thinking, how can I make this tool for people to be used? And the idea was always, to have AI on it, to take all the different little information that are inputted and feed back to you. and to tell the users and to tell the people what works for them and what doesn't, and figure out the patterns that you might not even be aware of.
I think it's great. I mean, we've got here two complex areas. You've got technology and you've got health.
Yeah.
So, and you've brought them together. So that's quite powerful in itself. So how do you ensure that, your app, WaveSix, is A, user-friendly and grounded in some science for those out there that may say, where is the science?
See, that's the interesting thing, because I don't think it needs to be based in science at all, because there's so many different aspects out there. When people say you need to be vegan, and then another expert says, no, you don't need to be vegan. So it's all about what works for you. You need to figure out, do I need to sleep 8 to 9 hours, or am I okay with 6 to 7 hours sleep? So it's more of a digital tracker rather than telling you what you need to do. So all the information comes from the things you track about yourself. So it's not based in science. So the idea is as well you can work with your healthcare professional and they can use the science, or you can use the science to figure things out that might interest you. Okay, I'll try cutting out gluten or ultra-processed food and see how that affects my pain levels, my medications, my sleep quality. So it's not, in a way, based on science as per se. It's more a digital tracker.
Yeah, I completely get that. You must listen to yourself, because it doesn't matter what's, you're not a chart. You're just not a plot.
Exactly.
A dot on a chart. You're a human being. So listen to yourself. Trust your intuition.
And I think that's what we've given up a lot. We just go to the doctors and they tell us what to do. So, for example, when I was diagnosed with MS, I went to the doctor, and of course, anything they would tell me, I would do, and I would completely trust them. And I didn't even think about that there are actually aspects that I can deal with myself, that I can improve. Fine, they know what they're talking about, but psychologically, there's still so much we can do, and we need to learn again how to listen to our bodies and to our gut, and especially the gut.
The gut, yeah. So yeah. I remember years ago going to a doctor, and he said to me, he goes, the minute you walk in here, I'm going to give you a chemical solution, but if you can find another one that works better for you, I encourage you to take it. And that's always stayed with me. It's really powerful that he knew that this is a chemical route, and it's a pill, it's dispensed. So.
Yeah. And if you think, there's so many people are long-term sick. So the economy loses about, I think, 43 billion pounds a year through long-term sickness. And 70 to 80% of those long-term sickness could be reversed through lifestyle changes. So there is a lot of science behind it. But if lifestyle changes would be a pill, everyone would be taking it. But of course, quite often it needs to have a little bit more input from the patients, and that's why they prefer to take pills.
Yeah, and it's very easy to say to someone lifestyle changes and not really quite understand what that means. And some people might try to eat healthier, but maybe they can't afford the healthier food, or they can't cook meals. They don't know how to do that, or they need to learn that. And there's all these barriers in the way that's stopping them from doing that, whatever that barrier is. So it's not as easy as just saying, make lifestyle changes and then magically you'll be better.
And I think psychologically we need to change our mindset, because you think, I need to do exercises and I need to go to the gym. No, you don't. That's why I called it in WaveSix, I called it movement, because just walk the stairs. Take the stairs and up and down and walk a little bit further. Gardening is movement. Just to think, that you're actually moving much, much more than you think you might do.
Yeah, I think that definitely starts with education at school, because you feel like PE is the subject and you go and do some specific sport or something, and you don't think that going for a walk is exercise necessarily until you start doing it every day and you realise, oh, actually, walking is really good for me.
Walking is one of the best exercises.
Yeah. But then they think, oh no, maybe I should be running, or maybe, and it's like, no, just do what you enjoy, find the activity that you enjoy, and go and do it.
And then that's what I think is about lifestyle changes, is they need to be small and sustainable.
Yeah.
So just setting yourself a rule, saying, I don't take the elevator, I take the stairs. Little things like this. And then over time, they will add up.
I mean, I see a lot of people sitting in the gym, so they've gone to the gym, but they are sitting on a machine with a phone, and then they leave.
Maybe they're relaxing.
Well, yes, maybe I've judged harshly, but it's movement. So let's keep moving.
Maybe they walked to the gym.
Julia, I'm really enjoying this. So, looking ahead, what are your aspirations for WaveSix and its role in the future of digital health?
I would love WaveSix to be accessible for everybody, either through their healthcare providers or just independently, and to make it a number one tracking tool, which then could be correlated with external trackers, which is not at the moment. At the moment, it's mainly focused on manual input, which I quite like because it encourages mindful tracking. So just rather than your smartwatch or your tracker telling you walked 8,000 steps today, make you think about, I walked 8,000 steps, I walked with a friend and we had a nice chat and I felt really happy. So just a bit more the subjective measurements. So I'd like to WaveSix be on the forefront of us taking a step back and trusting ourselves again, and not just the digital data that's coming out of these amazing trackers. This is but make it a bit more personal. Bring the humanness back in us.
It's, human is so important. And you talk about the human side of these tech journeys. And it's, you've got a powerful story, and I'm totally into the health thing, so it works. We're into the health thing. Okay, so we've got a feature on the podcast, which are 5 burning questions.
You're ready?
Yeah. Right. Shoot.
These are quick fire questions. So, ta-da! How did you fund your product?
At the moment, it's self-funded.
Okay, well, that's always a challenge in itself, also self-funding. What is the best marketing tip that you can share?
I'd say networking. Get yourself out there, be open, be mindful, make connections, and talk to some lovely ladies on a podcast.
It's good. We like that. Who inspires you and why?
Oh, that's a difficult one. I'm not sure if inspiring is the right term. I would take my children, just because they give me so much strength. They give me the reason to keep going, and they ask clever questions. They're inquisitive, and they push me forward.
What business tool could you not live without?
At the moment, Asana comes into mind, but that is a bit boring. Business tool.
If it works for you.
Yes, exactly. Let's go for Asana.
Yeah.
Asana, okay. And it's on a quick fire, so you've spoken about what motivates you when going gets tough. Can you expand on that?
When you start out as an entrepreneur, they always tell you, don't love your product, fall in love with the problem. And that's the motivation that I keep thinking every day. I get out of bed and I'm motivated because I'm thinking the problem is not solved yet. I want to help people. I want to get them a tool that hopefully makes them better, feel and lead happier and healthier lives. So that would be my motivation, all the people out there.
Excellent.
Yeah.
I like that.
I feel like you needed to be added onto the NHS
Excellent,
online
I like
system. I think just plug it in, get it sorted.
Holistic health. We need this.
Yeah.
We need more of it.
Absolutely. So if people want to find WaveSix, where are they looking for it?
So it's on the app stores. So WaveSix, or website wavesix.app. and they can find all the information on how to download it on there.
Brilliant. So we end our podcast with the final question, which is, what advice would you give to your younger self?
Don't worry so much. We'll all be fine. Trust yourself, trust your gut, be open, talk to people, be curious. That would be my main point. Be curious, ask questions, and keep learning. A growth mindset, definitely.
Yeah, that's lovely advice.
Yeah.
Thank you so much for being on the podcast.
Yeah, thank you.
Yeah.
Thank you for your tech journey.
Thank you very much for having me.